there are a whole bunch of different classes of medicines. Female hormone, estrogen, as I said, it's very good. So if a lady, goes to starts into menopause and then starts female hormone right then, you can basically prevent the usual bone loss you would see as long as they take the estrogen.
Mm-hmm.
And I have some ladies that are in their 80s that look great, and they got really strong bones, and you couldn't steal their estrogen away. But they're like any other medicine. There are some pros and cons of estrogen, and they need to talk to their doctors about that.
So if they can't or shouldn't take estrogen, what other medicines put calcium on the bones? If you've got osteoporosis that heals it, takes care of it, treats it, gets it better.
Well, the two first medicines were called miacalcin, which is a spray, and Fosamax. Miacalcin is not a real strong agent, and it's expensive and a lot of trouble, and I wouldn't recommend anybody using that nowadays. Fosamax is a very effective medicine, and there's another one called Actonel, another one called Boniva, and these have all been around so long that they're generic, so they're pretty inexpensive. The problem is that they are a lot of trouble to take because they're very poorly absorbed and very caustic, very irritative to the stomach. So you have to take them when you first get up with like 12 ounces of water. So you tsunami those things through the stomach, doesn't just sit there and eat a hole in it. And then you can't do anything else, no food, no other medicines for at least an hour.
You have to sit up straight?
You have to sit up straight so that you get it draining the right direction. And some people still, they get some stomach upset with it, or they may get some aching all over. So some people don't tolerate them well. But if you can take them without stomach upset and without the achiness, they're very effective in decreasing both spine and hip fractures.
That's Fosamax, that's Boniva, and Actonel.
They're all very similar in terms of their activity. And then there's a real long-acting medicine in the same class that was called reclassed, or it's now generic, so it's called zoledronic acid, and it's really potent. It's a stronger fracture reduction than any other medicine that's been around, and you just give it as a once-a-year IV. Just put an IV in, infuse it over about 20 minutes, you're covered for a year.
So it sounds like, to me, that'd be the easy way, the treatment of choice. That's called reclassed.
Well, or zoledronic acid now because it's generic.
It's generic.
The nice thing about it is, for a lot of patients, they're not real rich. And some of the newer branded medicines can be fairly expensive. But because it's the reclassed is given in a doctor's office or in a hospital outpatient facility, as opposed to having to go to the pharmacy and pick it up, because you have to give it IV, it's covered under Part B Medicare, as opposed to the prescription benefit. And so for a lot of people, if they have, Medicare and a backup policy, it's completely covered. So it's easy and cheap.
A new medicine, Prolia. What's it?
Now, Prolia is an excellent medicine. It's a newer one, so it's not generic, so it's quite a bit more expensive. But it's a completely different class. It's also real long lasting. It's just a shot. You don't even have to have an IV in, just have a shot every 6 months.
So that's pretty good too.
And again, if your doctor can provide it through their office and give it there, again, it's covered under Part B. You can just get it at a pharmacy and take it to the office and have the doctor give it. That also, works. But it is at least as potent as the IV reclassed, but it's just a shot. And the thing is, it doesn't last a real long time, though. Once you get to 6 months, its effectiveness starts dropping off, so you don't want to not take it. Whereas the reclassed, you can give it for maybe 3 or 4 or 5 years in a row, and it builds up in the bone, and then you can take a drug holiday, and it'll keep your bones strong for several years frequently before they start drifting down again.
Your advice to people on having good bone structure and not having osteoporosis?
Most important thing is to pick your parents right.
Okay. So your heredity is important.
Heredity is
Second
very
most
important.
thing is think about it.
Think about it. ask your doctor to think about it, because it's a silent disease. And you go to the doctor, you're complaining of a cold. Doctor's not going to think about checking your bone density. You have to kind of help the doctor out and say, I'm really interested in knowing how strong my bones are. Remember, it doesn't hurt until you fracture.
And then he has to get a DEXA scan, and from there you can make treatment decisions.
Absolutely. You want to know what you're treating, because some people amazingly will have really good strong bones and they don't need to incur the expense and inconvenience and potential risk of taking a drug.